Hello, this is Dr. Chad Kish. Welcome to Healthcare Ethics, Module 3, Principles of Healthcare Ethics, Lecture number 2. Today's lecture is the virtual presentation for Tuesday, February 18th. It is part 2 of 4 of the Principles of Healthcare Ethics. Please make sure you pay attention to this virtual lecture just like you would in class. You should take notes, be an active participant, do any of the activities that I prompt you along the way, and pay attention to both the audio that has the PowerPoint here and the video. The audio has my lecture and the video that has the PowerPoint. So as you can see here, we have the Module 3 learning objectives. We're going to concentrate on the highlighted ones for today's virtual lecture. We want to explore, discuss, evaluate, and characterize rights. We started with principles, rights, and laws last time, but we're going to work on rights such as autonomy, entitlements, moral, positive, negative, natural, and ideal rights in our professional settings, and we'll also relate them a little bit to personal settings. We want to investigate, explore, discuss, and apply justice. We want to be able to include distributive and procedural justice, as well as discuss material reasons to discriminate in various settings. And then our third learning objective for today, we'll examine and discuss some of the different concepts associated with principles. We talked about harm, but we will, last time, we'll continue to dive into that a little bit, and we'll talk about negligence, competence, coercion, altruism, and paternalism in various health and wellness settings. So those are the three we'll focus in on today, and you'll see that there's some overlap with some of the other learning objectives as we go. So here's an outline of today's information. This is the information for the full week. So for your hybrid day on Thursday, just make sure you pay attention to this whole virtual lecture here, and it'll cover all the information. So we'll review our principles. We'll talk about autonomy, competence, both procedural and distributive justice. We'll talk about material discrimination. We'll talk about both the need for and past discrimination. Talk about the concept of distributive justice. We'll talk about rights. We'll start talking about positive, negative, natural, and ideal, some of the different types of rights. We'll talk about entitlements, and like I said, we will not have a class meeting on Thursday, so we'll review and let you know all the different activities you have for Hybrid Thursday. So, to review what we talked about last week, what are the 4 major principles of healthcare ethics? You remember those? If not, you might need to go back and look over your notes again as we get into this. Those are going to be things that you should know on some type of assessment later. But the 4 major principles are non-malfeasance, beneficence, autonomy, and justice. We talked about the first 2 quite a bit last time and a little bit about autonomy and justice. We'll talk a little bit more about those as we go. How could you define non-malfeasance? Well, it would be to do no harm, not to wish ill or bad on somebody. How would you define beneficence? It's more than not doing harm, it's also to consider doing good. It has a benefit for others. It not just avoids harm, there's actually a positive outcome for other people. How is harm caused? Well, we looked at how harm could be related back to a lot of the different theories, but harm is caused by negligence. We could do this through omission or fraud or malpractice, or we could even do it through violating somebody's autonomy. So let's talk about autonomy a little bit more. So what is autonomy? Autonomy is that desire to be self-directed. It is the right, the condition, or the capacity of somebody to govern themselves, to self-govern. It might be for an individual, it might be for a society, but autonomy means you have that right or capacity to make your own decisions. So basically it means you can rule yourself. You can make your own decisions. When we talk about making your own decisions, it's really like could be related to healthcare decisions and healthcare ethics. If you make a decision for me, even if you do use the idea of do no harm, benefit only, all right, if you don't even involve my perspective or opinion in the decision, this is technically a violation of autonomy and could be a violation of the law. So autonomy is derived from the Greek language of auto, which means self, and nomos, which means rule or law. So that's autonomy. So you're not under the influence or control of others. And sometimes we have to think about this. Do people have the uh, condition and capacity to make their own decision, or do people influence or control or even rule others, even though it sounds like they're making their own decision? Maybe a child where their parents have influence or control, maybe somebody that's elderly, somebody that's really dependent on somebody else, like through economics or a place to live, or they depend on somebody else in a domestic type of situation. So when we talk about autonomy in healthcare, it implies that we must have respect also for other people's decisions. Not only do we let them make their own decisions, we have to have respect for other people's decisions, even if we don't agree with them. So in healthcare, we have a duty to provide treatment for patients. So is that duty to provide treatment and to do no harm and to do mostly good, but somebody's making a decision that doesn't seem like it fits that? Do we violate autonomy? So we have to remember, when we consider autonomy, we must remember not to judge other people's decision or reasoning. In the healthcare profession, we can't judge people's character or judge people's reasoning. We can look into it and see if there's like some sound reasoning, but we can't say, I don't believe in that. We don't want to judge their beliefs. So we must ignore the why and then treat the issue or the illness based on what that person wants. So there's some important conditions that we have to consider when we're assessing autonomy. Do we want to allow somebody to make their own decision? The answer to that is yes. But there's a couple of important conditions when we relate it to healthcare, right? So is somebody competent? So we have to assess or consider competency. Do they have the clear ability to make an informed decision for themselves? First of all, are they possibly under the influence of drug or alcohol? Or they have a mental or cognitive disability or challenge? Maybe they're having a psychiatric or psychotic break. Maybe they're having a temporary loss of rationality. Maybe they just don't understand what we're speaking to them. There could be a language barrier or an understanding barrier. Maybe they have Alzheimer's and they're not in that rationality phase that they can understand things. Maybe they're not quite competent yet because they are a youth and they're younger and they don't really understand the, the, the consequences of any decision. So we have to assess for competency if we're going to award somebody autonomy to make their own decisions. The next important condition is coercion. Does the patient truly have the freedom to choose when they're making their own decision? So we have to consider some of these situations. If somebody may seem confused or not really want to talk about it or just kind of goes along with somebody else, maybe they're abused or maybe they're, you know, under the control of somebody that's has narcissistic behaviors. That could be a spouse or a roommate or a family member. So we have to look, is there some abuse there? Is the abuser in the room? Are they in the waiting room? Are they right around? Maybe there's some coercion going on there. Maybe we need to talk to our patient individually. Adolescents, are they under control of their parents? Do they not want to discuss things or even with a healthcare professional because their parents are around or in the room? They might not want to discuss, or even disclose drug or alcohol use that could be leading to some kind of condition, or sex, or even abuse that's going on, whether that's in the home or outside the home, or STDs. A lot of times they're afraid of their parents. What about a drug abuser? They could be afraid of a person in the room, like could be afraid of getting arrested, could be afraid of getting sent back to jail if they're on probation or parole, or even having a record of drug abuse or drug use on their medical files. Or we could even think of somebody that's a victim of sexual assault. They might avoid discussing it altogether especially if someone that's involved or would judge them, or if they're not even ready, if that person's in the room. We have to just see if there's any coercion going on. So does that patient truly have the freedom to choose or discuss things freely? So these two important conditions related to autonomy in healthcare. Somebody has to be competent, and they cannot be under any coercion for us to provide them with autonomy. So there's a couple other important things we need to consider when we're talking about competence. Competence, does someone, like we said on the last slide, have the clear ability to make an informed decision for themselves? We don't want them to be under the influence of drugs or alcohol. We want to make sure they have the mental capacity to do this. They don't have any cognitive issues, no psychiatric issues or loss of rationality going on. They understand clearly what we're talking about. They're not ignorant of the situation. They have a little bit of background, or they can understand it and experience it. So specific competence is when a person may not be competent to make a certain decision. They may not have the necessary understanding for a certain or specific circumstance. They don't have the research. They might understand things, but they might be limited. They might not be fully able to communicate on a specific topic. A child might have a lack of experience. Somebody might not be knowledgeable. Somebody that's elderly might not fully connect everything. There might be a language barrier. So it might just even be somebody, there's people that are really understand certain things, and other things they don't know anything about, and all they can do is see the small picture and not look at the big picture sometimes. So there's some specific competence, so they maybe not understand a certain decision, and they're very limited in this way. Here's some special considerations for competence, things we have to consider. Can we use substitute judgment? So substitute judgment can be used when a patient lacks the decision-making capacity. Maybe they're incompetent, maybe they are under coercion, maybe they're incapacitated. If we don't have an advance directive on file to follow, doctors or family members will try to make contact with somebody that does possibly have an advance directive, or a family member, and sometimes you don't have the time to do that. Sometimes the doctor needs to make a decision for the patient and try to make it on what a reasonable person would do. Sometimes, if they reach a family member and still that patient is not able to make a decision, the family member may be the person that's substituting in to make a substitute judgment for the patient. When we do the substituted judgment, we have to use a reasonable person decision or thought process. It's really, for us to do this, we have to take ourselves out of our understanding, try to be a reasonable person, a hypothetical individual who approaches any situation with the appropriate amount of caution and sensibly takes action. So this reasonable person decision is used in court cases, really looking at negligence, or to see if a doctor overstepped their bounds, or if they did something that might be out of line. So would a reasonable person have done the same thing? Not necessarily a reasonable doctor or a reasonable medical professional, but medical professionals are held to a higher standard. And then there's the concept of informed consent. So informed consent is defined as the permission a patient gives a doctor to perform something, such as a test, possibly a procedure, but it's after the doctor has fully explained the purpose and both the positives and the negatives and the consequences and what they're looking for, and it has to be a full explanation, and then the patient would give the doctor permission, so they're giving them consent. So let's test your knowledge real quick. So let's apply theories and principles to this situation. If a decision seems forced on a patient, it may violate the principle of what? Would it be A, autonomy, B, beneficence, C, competence, or D, justice? The answer is A, autonomy. We would violate a person's free will to decide or make their own decisions if we force something on them. So we talked a little bit about autonomy. Let's move on to another principle of justice. So justice is the ethical and philosophical idea that people should be treated impartially, fairly, properly, and reasonably in circumstances where the law is concerned. All right? So fair behavior or treatment for all is one of the foundational ideas or concepts of justice. This includes the accused and the accuser. The accuser is the plaintiff and the accused is the defendant in a court. But everybody should be treated fairly and get to have their day in court to try to seek justice. So that's how our legal system is built. You're innocent until proven guilty. So there's a concern for justice, peace, and a genuine respect for people. So justice is genuinely respecting people and trying to treat them impartially, fairly, properly, and reasonably. So there's synonyms: fairness, equity, all right? Sometimes equality comes in there, but equality isn't always justice. We'll talk about that later. So if we want to dig a little deeper into the principle of justice to understand it, if we believe something is morally wrong, it's the opposite of just, or it does not provide justice. It's considered unjust. What sort of facts make something more than just wrong? What would make something unjust? This could be if some services are not provided fairly to people. We'll provide clean drinking water to this town, but we won't to that town. That's not fair, that's not impartial, that's not proper, and that's not even reasonable. So that would be an unjust action. When we go back to Aristotle, though he thought we should treat similar cases in a similar way. That sounds like fairly, right? Unless there was a relevant or material difference. So that'll get us to our material reasons to discriminate that we'll discuss later. So similar cases in similar ways, unless there's a relevant or material difference. So when we break down justice, we're going to dig a little deeper into both of these. There are two types. There's procedural justice and there's distributive justice. So when we talk about procedural justice, we ask, were fair processes, rules, and procedures in place? And did we follow those procedures? Right? Did we follow the law? Did we do things that went by the processes? And when we talk about distributive justice, we ask ourselves, did we allocate resources fairly? Did we distribute things evenly, reasonably, properly? Both types of justice are related to the idea that distributions of benefits and burdens are out there. Remember, the benefits are the good, the burdens are the bad. They could be consequences, they could be costs. But the allocation should be equal unless there is a material reason to make them unequal, or what we would call discriminate. So we'll talk about procedural justice. Procedural justice is the idea of fairness in the processes to resolve disputes or allocate resources. So it focuses in on the processes, making sure people that make decisions are neutral, they have respect for others, both sides are given a voice or a pathway to get due process, and then that the whole process is done in a transparent and trustworthy manner. So it means, in a way, that you should get your turn or you are treated like everyone else should be treated. Right? If we're looking at procedures, you get your turn in line, you waited in line, you should be treated like everyone else. Right? If you're waiting at a line in a doctor, is it fair for someone to cut in front of you? Well, some would say no, some would say yes. If you just got a headache or you haven't been feeling well or you think you got the flu and somebody comes in and it's an emergency situation and they're bleeding profusely and just got in a major car accident, I think most people would say, yeah, there's a reason that they should get to cut in line. We don't normally like people that cut in the line, but I would think that situation's more severe, and if I was in that situation, I would want to be treated that way. Another thing we talk about with procedural justice is due process rights. So due process means basically you have the right to be heard. If you get arrested, you have the right to go to court or to talk to the district attorney and appeal possibly anything. You get your day in court, you get to be judged, right? You get to speak about how you feel or your right to be heard, basically. So that's going to be called due process, and that's a procedure. That's a process. Procedural justice and due process should be considered in healthcare decision making and really in any decision making. In policy making decisions, is everyone treated fairly or equally? Well, sometimes. So if you're in a county hearing on health, if there's a 3-minute time limit, do we strictly enforce this limit? Sometimes places do, and sometimes people try to go over their time limit. But if you don't, that's not being fair in the process. If one person gets 5 or 6 minutes and another person that wants to go 5 minutes only gets 3. Another thing is, if we know someone and we are working as a in the city office, and we have contractors doing bids on a job, but we have a little leeway to say it's not necessarily always the cheapest. Sometimes we can look at the overall bid and say, well, there could be a reason why we use this one. And if we know somebody that's bid isn't the best, and we want to try to do a friend a favor, is that following procedural justice? Is that fairness? Is that everyone getting their equal turn or being treated like everyone else? Do we possibly bump someone to the front of the line because they did us a favor? Maybe they took us to dinner, took us to a game on their company card, maybe played a round of golf, took us out on their boat. Do we make sure that we give them preferential treatment? Well, sometimes in America, that's how things seem to work. But that isn't really procedural process. That's not fairness in the processes. So procedural injustices do occur, and they may occur with various employee situations. When we are making employee cuts, there's employee cuts going on all over this country. Who is let go? Do we terminate someone over cutting cost and say equipment might seem like an unjust act? We could cut cost, but we need this equipment, so we're going to just terminate an employee. Like, in procedural justice, we have to be unbiased. What's more important, the employee or the equipment? And then if we have to select between two employees, we have to have an unbiased approach and even see if there's some processes or procedures in who we let go. Does the company have a procedure for this? Do we keep people with the highest seniority? Or do we let them go because their salary might be higher? Do we use a performance-based evaluation system and keep the people that are the best for our company? Or do we look at future potential in the next year this person's finishing this training program or they just started training and they show potential? Or do we just look at the bottom line of salary and say, if we get rid of this person, we could almost keep 2 other people, so that might be the person to let go. So if there's a policy, we have to follow policy. If there's not, we have to act in an unbiased way because this is a difficult decision to make. So we have to be fair. So there are 4 pillars of procedural justice. So these are things we have to do anytime we're going to try to apply procedural justice to a situation. We have to be fair in the process. We have to try to be neutral and not give one person an advantage over another and just try to be fair and look at everything from that standpoint where nobody has an advantage at the beginning, or no decision has an advantage before we even start looking at it. We need to be transparent in our actions. We need to be able to justify or defend why, and it needs to stand up and what other people would probably do. We need to try to provide an opportunity for a voice. If we're going to have to let people go, we might give them an opportunity to discuss with us or the committee, why they're valuable to the company. Or maybe, if several people know they could be cut, maybe people could, like, oh, we can work, for 10% less, we can take less contract or give up vacations or give them an opportunity for a voice. Last thing is, you need to be impartial in decision making. So you have to be fair, transparent, provide an opportunity for a voice, allow people to be heard, and you need to be impartial and put that fairness, treat everybody, in a trustworthy manner, and make a decision that conveys that you've thought through the whole decision and made the best decision, and there's no real giving somebody an advantage because of one reason or another. So we talked about procedural justice. Let's really talk a little bit more about distributive justice. Distributive justice is the perceived fairness of the allocation. So it's how people judge what they receive, or the justice they receive. Is it distributed fairly? So it considers balancing things like benefits and burdens. We have to determine what's fair and to determine how to divide the benefits. That could be, anything we get that's a positive. And then divide the burdens, and that could be anything that's a cost or a negative. The socially just allocation or distribution of resources, goods, and opportunities in a society needs to follow distributive justice. So if we have to ration out different things like food or water or even income, like who's going to get money, how do we do that? How do we distribute those resources or goods or even opportunities to earn income in a fair way where there's some socially just allocation in our society? Right? So we have to think, like, that's when we talked about the other time, like, why does a surgeon get more than just your typical MD, that gets more than, your direct care, home care, healthcare aide, that gets more than your janitor? So how do we distribute resources fairly among members of a society? We have to consider all kinds of factors. There's wealth, there's income, there's social status. So how are we going to distribute things among different people? Some people know, I know a guy, I know this guy, all those different things. So when we consider healthcare, healthcare is a resource allocation. How are we going to distribute healthcare? It could be an example of a distributive injustice. The Kaiser Family Foundation report, which is a popular report in the health and wellness area, the statistics show that 1% of the U.S. population uses 24% of the healthcare resources. So 1% of the population uses 24% of the healthcare resources. That's not equal distribution. Half of the U.S. population receives 96% of those resources, while the other half only gets 4%. Well, that's not anywhere near fair. But is that because some people are healthier? They do things to, be healthier up front. They do some preventative things. Maybe they're younger. But if we're paying health insurance, we might be paying something pretty similar. So we've outlawed the ability to change that with different people, with the ACA. So why is this occurring? Is there just a segment of the population that's healthy and another segment that's not? Or could it even be that there's a segment of the population that has access to health care and another segment that doesn't? So that could be an example of distributive injustice that we could have to dig into a little bit deeper. So, being that not everybody gets health care easily, and it is expensive, and there are people that go without, Healthcare is currently considered a scarce resource. So we have to consider distributive justice with healthcare. Resource allocation issues are common in healthcare. The difficulty of the task of distributing healthcare resources and cost fairly while seeking affordability, availability, and quality all at the same time can be difficult on industry professionals. Let's take another quick test of our knowledge. See if you can apply theories and principles here. What kind of principle can we apply? Let's see your degrees of understanding. Blank is defined as the ability to fully understand and make decisions on some things, but not others. Is that A, specific competence, B, procedural justice, C, beneficence, or D, distributive justice? If you answered A, specific competence, you'd be right. You can be competent in a limited way. You can be able to make decisions and totally understand some things, but you might lack the understanding on a certain topic to be able to make an informed decision. So let's do a little bit about a think, pair, share activity, but we won't pair and share here, but this is journal activity number 12. You need to write this down. So let's consider distributive injustices in healthcare. So think about this. Try to take a time and pause this and list several examples of distributive injustices in healthcare. What do you think is a distributive injustice that could be unfair? An unfair example of how healthcare is distributed. All right, so one way is you could be a manager in a healthcare facility and you have to choose a budget item. Do you spend that on equipment, on a capital project such as building, repair, or do you spend the money to hire a new employee or even to give raises? So that could be a distributive injustice. Distributive injustices go back to the percentages we talked about from the Kaiser Family Kaiser Family Report of, 50% of the population getting 96% of the healthcare. We could even look at different prices based on where you live and your age for health insurance, different prices on procedures, access to health care. All right, there's all kinds of different things we can think of when we talk about distributive injustices. All right, so we're going to talk about some material reasons to discriminate, and that would be to change how we treat people, to not treat them fairly. So when we're talking about discrimination, we're talking about treating people not fairly. So direct discrimination happens when a person or group is treated less favorably than others, and there's a specific reason. So question, is it ethical to directly discriminate, to treat people less favorably than others for a specific reason? Think about that one for a second. Well, you probably discriminate every day. You treat some people more favorably than others because they're your friends or because you like them. Think about it when you're determining who you might want to go on a date with. Got to figure your criteria. Are you going on looks or personality or different things? You're going to treat people more and less favorably all the time. So people do discriminate. I guess they choose one person over another for a specific reason. But is that ethical? Well, you're going to have to determine your own ethics. So why do we choose one person over another? Do you consider a certain set of qualities that you consider this one's important, that one's important? I like this more, I like that more. Why might you provide better opportunities for one person over another? So if we're hiring for a job, why would we choose one person over another? We're going to look at all the qualities probably that are required for that job, and we're going to have to kind of rank them and then consider what we think is most important and then make a choice. When we're looking at providing better opportunities, that really follows under this direct discrimination. So we're going to provide, we're choosing. The other one, we were just choosing people, and there might be a specific reason or a specific set of qualities. So you might not like qualify that as discrimination. You're considering that making a choice. But when we provide better opportunities for one person over another, that is choosing to treat somebody less favorably. We might do this because the person either deserves it or needs it. We look at it that each person should get an equal share unless there is a material need or justifiable reason to discriminate. Those two reasons are the person needs it. They need it to survive or possibly be equal, or they have a tragedy or unforeseen circumstance. Think about that when we provide supports to somebody on an IEP, or we provide uh, the American with Disability Act provides different services at work and work areas, or even in buildings. Like, people need different things, right? Some of those things might have happened because of a tragedy. The other reason is a person deserves it. So maybe, like we talked about a couple weeks ago, somebody has a specific skill set. They've worked hard. They've gone through training. They went to college. They've put a bunch of effort. They got all kinds of different skills. Or maybe they deserve it because they were part of discrimination in the past. So if you work hard, do you deserve to be rewarded? Most people in our society believe that's a good reason to be rewarded. How do you determine if someone deserves it? So the two most common reasons our society discriminates in the provision of an equal share are being deserving. You're worthy of merit, having specialized skills, or your contributions, efforts, and experience. And then the third thing would be is to make up for past discrimination. How do we consider if someone needs it? The reasons based on the need of an individual or group. Needs can be based on various reasons. We'll discuss needs a little bit more as we go. But there's going to be specific reasons somebody may need uh, more than an equal share. So in contrast, if you disobey the law, do you deserve to be punished? Which means you would get less. So people that don't obey the law could be treated less favorably, and there is a specific reason because they don't obey the law. They deserve to get less. So that can be pretty deep there, but that is a principle and some ethics there that, even though we might not use the word discriminate as we think of in discrimination based on race or gender or socioeconomic class, but discriminate means treated less favorably. So when we provide advantages for people that may have needs, we're said to be discriminating based on needs. So do you feel discriminating, treating people differently based on needs, is morally acceptable? Some people do, most people do, some people don't. So we're going to go through some common needs-based group and think about these. Which of the common morally acceptable needs are you comfortable providing discrimination for, or providing more for? Some you'll say, oh yeah, and some you'll say, I don't know, and some are like, But everybody's going to be different, kind of based on your philosophy and your values. So common needs-based groups that generally receive anti-discrimination, or that's morally acceptable to discriminate to provide them with more than an equal share. Somebody that has misfortune or even a disability, right? Their house burned down, there's a misfortune, people are going to, chip in to do different things for them. There might be a building situation where a builder will build them a house. Maybe a disability, a mental or physical disability. Right? People are going to receive different supports, different things, like we'll have cutouts so wheelchairs can go up and down. We can push the button and the automatic door will open, elevators in places. So there's all kinds of different things, closed captioning on the television. People that have special talents or abilities, they might get different opportunities. So this can include salary, a higher salary, or even bonuses. All right. It, but people might have opportunities lost, that they were passed over, and then we got to look, is it fair to give an individual reward since they lost a previous opportunity because they've continued to work hard and they probably deserve it? So how do we consider that? Past discrimination. So past discrimination is more than just a lost opportunity. It's discrimination against a certain individual or even groups of individuals. Is it fair to give this individual a certain reward or benefit since they were unfairly treated previously? Or it may even be since somebody in their specific racial, ethnic, cultural group was discriminated, so we're going to provide more opportunities for these groups, gender groups. So Title IX could be an example. Females have been discriminated against, and now there's more gender equity in all educational opportunities. Then the last one would be structural social problems. So these would be societal issues that restrict opportunities of any individual or group. That could be groups like in a geographic area, a socioeconomic status, right? Could be different people, like society tends to favor this group over the other, or we're going to provide opportunities for certain groups. They could fall in some of those other categories, but if your parents didn't go to college and get a degree, you're probably less likely to go. First generation college students are more likely to drop out than, you know, a student that had one parent or both parents that went to college and got a degree. So there could be some structural problems there. So in today's global society, most people, when they get in discussions, feel it's morally acceptable to discriminate based on some material needs. Now what material need it's going to be is going to be differing by person, but most people say they're going to allow this. This is where we take the patient with the most serious injury or illness first in the emergency room. Most people are going to agree that's a material need. And as we look through some of the other ones, the percentage might change on if people agree or not. So if you're in need because of misfortune, a person was in an accident, seen as a person with an injury, we might ignore whose fault it is. If it was a car accident, and whoever has the worst injury, we take care of. We might look at someone with a disability, somebody in a disaster, somebody with reduced capacities, and consider to give them some extra based on their misfortune. Remember, we've talked about special treatment because of special talents. Most people kind of consider that. This could be seen as efforts to help someone with special talents. Somebody has a special talent, we're going to provide them with a scholarship to go to school. They have this special talent, but they don't have the economics to be able to do it. So let's find them a scholarship or a grant or some kind of tuition aid. Is this special treatment if a pro athlete jumps in line for a surgery, even though their condition is lesser of an emergency, but their livelihood depends on it because of their physical status? Is it fair on special talents if a surgeon with specialized skills gets paid more than a veterinarian that works on animals? So in global society, you should be rewarded based on how much you contribute or how much effort you give in any situation. So this could also refer to hiring processes, promotions in the workforce or the healthcare setting based on past performance, specialized talent, work ethic, your perceived ability to contribute. Some people think that's fair and some people won't. So this thinking in global society also applies to patient care. Consider several examples of material reasons to discriminate in healthcare. Could be where we provide somebody with some extra, or maybe even let somebody go first, such as children, the elderly, a pregnant female. People like that get special consideration sometimes in healthcare, or the people that are the most sick. or have the most serious condition. Most people would say it's morally acceptable, but if everybody's got to wait in line, is it really fair because they didn't wait in line? So let's consider those other needs to provide some advantages. Misfortune or disability. An example would be the American with Disabilities Act, also known as the ADA. It helps provide fair opportunities for employment and access to facilities for individuals with disabilities. There are even then special care facilities for people with misfortune or disability. When we look at healthcare, St. Jude's Children's Research Hospital, only for children, and it's free of charge. The Mayo Cancer Center, only for cancer patients. Duke University Research System. So we have laws, and then we also have things in healthcare. When we look at past discrimination, when society tries to remedy past injustices by providing different treatment or providing advantages for individual groups. This is considering trying to overcome past injustices or fill a need due to past discrimination. It could be restricted access, an individual giving someone a promotion because they were unfairly passed over last time. But if we look at a group, it could be the Civil Rights Act of 1965, where, you know, people got different resources, access to different resources, got different rights to overcome discrimination. So here would be an example of how this is used. The EEO, Equal Employment Opportunity Laws, and there are a lot of them out there. They prohibit discrimination based on race, color, religion, sex, national origin, age, or disabilities, and provide equal wages for equal work. So this is applied in all work settings and in healthcare settings as well. When we continue on this path, considering other needs to provide advantages, special groups. The Veterans Administration, Veterans Health Administration, it's only for medical care to military veterans. It's the largest healthcare system in the world. It was developed to focus on misfortune or disability, past discrimination in healthcare because veterans came back and didn't have health insurance when they came back and were overlooked. It provides opportunities for veterans, and it's partially due to some structural problems for access. Like when they came back from being in the war, different wars, World War I, World War II, Vietnam, you know, if they were injured, they basically had no jobs to go to. Where were the insurance going to come from? These veterans were just kind of left behind. Some structural problems. So once again, what are structural problems? Do we understand what that means? So structural issues could be people's access to health care. It could be how poverty plays an effect in your ability to have good nutrition, good wellness, even ability to obtain health care, obtain your correct medicine. Poor education, not understanding how to get health care, not understanding how to find valid and reliable resources, right? Not understanding how to do different things to be preventative. Understanding health and wellness practices, or even having access to places to do that, or funding. Equitable, fair, clean housing and living environments. Transportation, that could be to healthcare, to wellness opportunities, to jobs, to school. We can look at insurance. There's some structural problems with who gets health insurance and how much it costs and what it provides. And then always socioeconomics or economics or money plays a part of structural problems in America and across the world. So this is an in-class activity. So you need to do this on a separate sheet of paper or in a separate document, and you're either going to submit the document or take a picture of this specific piece of paper where I can read it and turn it in. If you take a picture of it, I need you to put your name on the top of it. So here's what you're going to do. We're going to talk about this specific scenario, judging in the emergency room. And you need to do this, and you're going to have to submit this to get credit. If you don't, you won't get credit for this activity. So if you don't watch this video, it's going to be really hard to do. The scenario is you're working in the capacity as some kind of nurse in the emergency room. All right, so you're a nurse in an ER, an emergency room. 2 ambulances show up at the same time and bring in 2 people on stretchers, and you hear the EMTs talking about it. These 2 people were from the same car accident. All right. So use your ethics, principles, and morals. So the ethics you learned, your principles that you're learning, all right, and your morals, and then consider the ideas like distributive justice, as well as considering needs to determine who you're going to treat first. So, I said, use a clean sheet of paper, put your name on the top of it, unless you're going to type it into a document. And you need to, I'm going to give different prompts with a number. So you're going to write down the number, and you're going to write down what you're thinking after that prompt. Because about your ethics, principles, and morals. Like, you got to think, what's the first thing that popped in my mind, and who might I be leaning towards treating, and are there any ethics? Remember our 6 different ethics, or any principles, or any of your morals, or anything we just talked about, distributive justice or needs that would fit with each one. And you can pause these because I'm not going to spend forever in between each one. You might want to pause them and write them down. 1, your initial treatment decision. One of them is a male and one of them is a female. One of them is black and one of them is white. So this is a what if question. I didn't give you it's a black male or a white female, but what if one of them's a male and one of them's a female? Gender comes into the issue. What are you thinking? What if one of them's black and one of them's white? Race becomes an issue. What are you thinking? So write that down. So you might want to pause this, write down your thoughts, relate it back to ethics, principles, morals, consider distributive justice and needs. After you get done with that, you'll do number 2. They're both seriously injured. So if the injuries are the same, they both seem to have a compound fracture or a broken leg, who is first? Then I'm going to throw the twist in. After you answer that one, add in part B to 2. What if the female happens to be noticeably pregnant? Does that change your way of thinking? So pause that and consider all the things you're supposed to. Number 3, the person that caused the accident is drunk and the police are accompanying him. Do we treat the person that was the victim first? What are your thoughts here? One of them is under 18. They happen to be a child. Do we treat the person under 18 first? After you think about that and write that part, that's part A. Part B for 5 is, well, what if that child is disabled? They happen to be injured in the car accident. They weren't the driver, but that child is disabled. Part C for 4 is, what if the one was a child, but the other person is elderly? How does all of those different things weigh into our thinking of ethics, principles, and morals? Number 5, one of our 2 people is a pro athlete. right? One of them is a pro athlete. Number 6, oh, it plays off of the pro athlete. The pro athlete has been here before, but it was under the same exact circumstances. They were injured while driving a vehicle under the influence of alcohol. So do we treat the pro athlete differently? The repeat drunk driving offender differently? How do we treat the issue? Do we consider the person's character? What are our ethics, principles, and morals? Consider that distributive justice and needs. So you might have to go back and do that one at a time. Take a picture of your activity when you get done and post it to Canvas by Wednesday, February 19th at 8 p.m. to get credit. So when we consider distributive justice and how that overlaps with rights, in the U.S., some people are still debating if health care is a right, everybody should get it, and everybody should get an equal share, or it's a commodity. So to understand that debate, most of us understand what a right is, but let's make sure we know what a commodity is. What is a commodity? A commodity is an economic good, usually considered a resource. It can be bought, sold, or traded, and it has value. Let's dig in a little bit, make sure we're considering rights correctly. So, is it a right or is it a commodity? If we're talking about rights, there are legal rights. Legal right means there is a law concerned and you're entitled to it. The law says you're supposed to get it. You deserve it. It's actually written exactly into the law. That's a legal right. So if healthcare is a right, where is it written into the law? Right? Some of Obamacare is still there. Some of it's overturned. How are we using it? Like, is it a legal right? Or is it a moral right? A moral right is something you deserve based on principles of society. So this overlaps with justice in a way, distributive justice. It's fair and you should be entitled to have it. The key here is a moral right may or may not be a legal right. If it's written into the law, a moral right could be a legal right. If it's not written into law and it's just a policy or what society believes, it could be a moral right and not a legal right. So there are many types of rights. Just like these two, some moral rights are legal rights, some aren't. They may or they may not overlap. So think about it. Should healthcare be a legal right that everybody's entitled to and it's written in the law, or a moral right? Or is it a moral right that should become a legal right? Or is it really just a commodity? So you need to think about that, and we could continue this discussion next time we meet. So we talked about moral rights and legal rights. There's some other rights out there, such as positive rights. Positive rights also means that you're entitled to something. It's related to a legal right, but it focuses more on a specific service or some kind of specific good. An entitlement is also a legal right because those are rights that are written into laws. But it's not necessarily like a right that has value that you can trade. It's not like a commodity. An entitlement is more of an idea, such as due process. You get your voice to be heard, you get your day in court. Or it could be HIPAA, the Health Insurance Portability and Accountability Act. Or it could be FERPA, the Federal Education Records and Privacy Act. So, like, it could be different things that provide you some different type of rights, but they don't necessarily provide you with goods. Enforcement of rights is an important part when we're talking about our different rights. How do these rights get enforced? sometimes legal rights become really those that you can enforce. You may have the legal right to health care services under Medicare, but that's, have you ever been or heard your parents say this specific provider doesn't accept Medicare? So it might not work. Another example is Roe versus Wade. Roe versus Wade getting overturned. It goes back to states' rights. Is abortion legal in the country, or is it state by state? You might not be able to obtain this procedure because it's illegal in a specific state, or the provider doesn't offer that procedure because it's against their ethics. So even though you might have certain rights, you might not be able to enforce them. Substantive rights may or may not be legal rights. Another one of these that overlaps. They're similar to positive rights, right? Because you're entitled to something, but they're not legal like entitlements. They're not written into the law. They're a right to only a particular thing, such as education, health care, minimum wage, right? And these rights vary wherever you're at. So different nations, different municipalities, different states have differing opinions about substantive rights for their citizens. So these things may not be in a federal law, they may be in a state law, or they may be governed by the local board of education. So some of these different things may or may not be a positive right or a legal right. They may just be a substantive right. Because it might be Missouri passed a law that you have to pay so many dollars per hour as minimum wage, but you really don't. If you're a small business or you work in the food and beverage industry where tips count in, you don't have to follow those rules. So even though it's a law, it's substantive. When we dig deeper into rights, as we dig deeper into rights, we get on the flip side, negative rights. Negative rights restrains other people or even governments by limiting their action towards us or the right holder. We have some rights and you can't take this away from me. All right, so they're not negative for you, they're negative to protect you. They're negative that they shield you from other people doing things. People can't take things away from you. So the Bill of Rights was the first big law that lists many negative rights. The right to liberty, to justice, to freedom of speech, the right to bear arms, your freedom of religion. We can't force religion upon anyone by the state. These are all considered legal rights too, but they're negative rights because people can't take those things away from you. They can't make laws or impose policies to take these things away from you. You have the right to be left alone. You should be able to do things that aren't outlawed or forbidden by law and not be bothered if you're a law-abiding person, especially on your own property. Negative rights of one person, though, sometimes conflict with the negative rights of another person. You might think I have the right to smoke, but another person has the right to be smoke-free, and you could be in the same common area. So then laws tend to be made to restrict people's rights because they infringe upon another person's freedom or rights. So there's a gray area in these negative rights. Negative rights also include the freedom from things that take away your liberty and justice and ability to, you know, live without having things forced upon you, like sexual harassment or a hostile work environment. So you should have freedom from those type of concepts. So some of those become laws too. They get written into law and become legal rights. We haven't got to the left yet. We're still on rights. There's natural and there's ideal rights. So natural rights means that you respect the attributes that people have in nature. Think of natural law and some of these things. Aristotle, St. Thomas Aquinas explained that natural rights are those that best support the achievement of our highest good. our wisdom, our ability to have character for things that happen in nature. They go back to a little bit of biblical principles. Thomas Jefferson also talked about natural rights. He stated in the Declaration of Independence that these rights include life, liberty, and the pursuit of happiness. So those are your natural rights. John Locke wrote about natural rights. Life, the natural right to live. Nobody should be able to kill you. Nobody should take life away from you. Liberty. Liberty is free will, the right to make your own decisions and to do your own things. The only way we should limit free will, John Locke wrote, is if it conflicts with the other two natural rights. All right? You kill somebody, you don't have the free will to that, or you infringe upon somebody else's ability to pursue things like owning property, and that was what was considered the pursuit of happiness back in the day, was property, your estate, your wealth. Number 3 is the ability to own property or your estate or to have money. All right, so that was John Locke's take on natural rights. Ideal rights take that a step further. Life, liberty, and the pursuit of happiness. Like I said, that goes back to Thomas Jefferson and the Declaration of Independence. This is fundamental to the enjoyment of all other rights. We have the pursuit of happiness part. If we can't pursue happiness, like the life and liberty isn't really that great. So Thomas Jefferson wrote about ideal rights in the Declaration of Independence. He changed property from John Locke to the pursuit of happiness. Here's some considerations for these two rights. Natural and ideal rights attempt to allow humans to reach their full potential. If they work hard, they do things, they earn things, they don't infringe upon others, they have their own free will, they get to desire things. If you're going to pursue things, you have to go after them, so you have to try to reach full potential, right? So life and happiness are important parts of holistic health, and they're important to reaching our full potential. We have to live, and we have to be able to be happy, or we're not emotionally well. Natural rights express our common morality. We need to live. People do die in this society. An ideal right should motivate or inspire us to reach our full potential, to pursue things. All right? Ideal right focuses on the pursuit of happiness part. It's meant to be motivational, to pursue something, to seek a goal, to reach down and do things. So let's test your knowledge here. Another test of knowledge. Which right is it? All right? Is it freedom of speech? Which one is freedom of speech? Is it A, negative right, a B, legal right, or a C, entitlement? It is a negative right because people can't take the freedom away from us. It's also written into law, so it becomes a legal right. HIPAA, number 2, the Health Insurance Portability and Accountability Act. All right, it's has some safety to records, but then doctors also have to provide records, allow you to port them from one provider to another. Is that a negative right, a B, legal right, or a C, entitlement? If you said C, entitlement, you'd be correct. And the right to vote. What is the right to vote? Is it a negative right, a legal right, or an entitlement? Well, it was written into law for citizens of a certain age and without felonies and convictions and different things like that, that it becomes a legal right, a B. So let's review today's learning. Can you explain autonomy? It is the ability to make your own decisions, to have free will. You need to be able to define competence. How would you define that? It's when someone has the clear ability to make decisions for themselves. They're not compromised mentally, physically, they're not coerced, right? How would you explain distributive justice? It's the perceived fairness of how goods and services are allocated, the distributive part, how things are distributed, how they're given to people. Explain legal rights. Can you do that? Legal rights are written into law. They might be all kinds of things. They might be entitlements. You're entitled to something, but anything that's written into law becomes a legal right. Can you explain negative rights? Negative rights limits a person or government's actions or abilities towards the right holder. People can't, the government or people can't take things away from you. So as a reminder, it's Hybrid Thursday. You had the virtual lecture for today, so we won't be in class again until next Tuesday. There's no class meeting on Hybrid Thursday. I won't have a separate Canvas page for Hybrid Thursday because all the information will be in this virtual lecture. So make sure you complete the assignments. I'll give you the to-do list next, and I will talk you through each of the assignments after that. So your to-do list for this week. If you haven't read the textbook or finished reading Chapter 2, Principles of Healthcare Ethics, you need to go ahead and knock out the rest of the chapter. So concentrate on the rest of the principles. We did the in-class activity within the presentation, judging in the ER, and you got the different situations. So post a picture if you did that on paper with your name on it, or if you typed it in, post the document. That needs to be done by February 19th. There's probably no way to do this without watching the video. If you don't watch the video and don't do it, then I guess you just don't do it. The next assignment is going to be a discussion. So a discussion has your initial posting that's due on Thursday, February 20th, and your 2 thoughtful responses to classmates. Check to make sure what those are. They might have you disagree on one of them. Those are due Saturday, February 22nd. So the discussion is on past discrimination. So dig into the part about discrimination. Assignment number 3 is an assignment determining your research question. That's due Friday, February 21st. You need to make sure you look at the feedback from your topic selection assignment. Within that assignment, I will post everybody that selected a topic. There's still several that haven't. A document that has those as well. So look at those. And you need to figure out what your research question based on your topic is going to be to make it controversial on your topic, but debatable so you can find research on both sides of your topic. And then your last assignment is due Sunday, February 23rd. It's an assignment based on negligence, autonomy, and harm, and it's going to be a review of some of the chapter information. So this is a discussion, but it's also a bit of a research assignment on past discrimination. So what you're going to do is analyze research on past discrimination in healthcare. It needs to be past discrimination in the healthcare industry. To discuss the development of a law or possibly a company policy, and then determine the impact of that action. So here's the outline. There's more information in Canvas. Part 1, you'll put 1 article research, and then you're going to list those 5 things: the name of the article, the name of the author, the official name of the law or policy, and then tell me if it's a federal, state, local, or company policy, the date the law or policy went into effect, not the date of the article, and then the hyperlink to the web address you obtain the information about the law. Number 2, article summary. So make that your heading, and then provide details on the background information. How did the issue come about? That's going to be your first paragraph. Your second paragraph, fully detail the past discrimination that this law or policy was written or developed to overcome to help provide equality for an individual or group. So paragraph 2 is about the past discrimination. Paragraph 1 is some background information, how the issue came about. Like, was there a group or an individual or a union that brought the law up? Did they take it to court? Did they go to a company? So that was their background. Then your past discrimination. And then paragraph 3, you want to explain the impact of the action of that law or policy. What kind of changes did it lead to? Were there other similar laws affected after that? Did it possibly go to court and get overturned? So your assignment deadlines, you're going to post that article summary and your research information by Thursday, and then you're going to reply in 3 sentences to 2 different classmates by Saturday. All right, I'm not going to have you really debate there, but look at the information in Canvas to get a little more detail of this assignment. So the assignment for Friday, February 21st, is determining your research question. So you will compose a clear and concise, ethically debatable question to transform your research topic into a debatable research question. So look at the list of approved topics and use your approved topic for this assignment. I'll put those up probably by Wednesday. I'm going to email the last couple people. There are 2 people that haven't turned in topics yet. Next, you're going to develop your research or thesis question to make your topic debatable. So if you've already turned it in, go back and look at your topic selection assignment. I told you in that selection assignment what your approved topic is, so you can use that even if I don't have the list up in the assignment. So what you're going to do is develop a research question or thesis question to make your topic debatable. So you have to frame your topic as a question that can be considered controversial. So a reasonable person would have to apply an ethical theory, a principle or 2, possibly some laws, and we haven't learned this yet, but go over decision-making models to try to determine an answer. When you do this, though, you're going to have to research both sides of your research question. So you're going to have to find stuff that will back up a yes and a no to your answer. So you should provide probably several different options, and I can explain to you, choose this one, or you're on the right track, or help you modify that. So you need to have this up by Friday, and then you need to be looking at your feedback, because I'll try to give you some feedback over the weekend to help you get this narrowed down. And if we don't have it narrowed down by next week, I'll have you come meet me after class on Tuesday, or before class if possible. So your research question, here would be an example. If your topic is abortion, right, you can't just use abortion. You would have to explain, make a question about abortion. Should abortion be legal, or should people have to do blank, blank, blank before being approved for abortion? So like I said, you're going to have to be able to find research on both sides. The next, like another example would be if we want to talk about organ transplants. Well, you can't really just say are organ transplants ethical, but you got to dig in deeper to that. Like, should this occur if you give an organ transplant? Should you have to be able to do this, this, and this before you can? Like, you're going to have to find things that you can back things up with theories, principles, and laws. It's got to be a debatable question where if you polled the audience in the room, you'd have at least 4 or 5 people on one side of the topic and the rest on the other, or even a 50-50 split. So that's how you write your research question. And the last assignment, this is for Hybrid Thursday. The aspiring wellness professional will analyze and discuss how negligence and violating autonomy in a healthcare setting can lead to harm for patients and clients. So follow the outline. You'll see more information in Canvas when you open it up, and provide detailed information. So in part 1, negligence. Harm can be related to negligence in a healthcare or wellness setting. For A, provide 2 or more detailed sentences to fully describe terms that relate to negligence. For B, provide 1 or more sentences that apply to your understanding of negligence by explaining a situation or scenario where it would cause harm in a clinical setting. So you're going to have 1 through 4 here, and you're going to put an A and a B under each one of these. So negligence will have an A and a B, omission will have an A and a B, fraud will have an A and a B, and malpractice will have an A and a B. So you're going to describe negligence in A, 1A, we'll put 1, negligence, A, and you're going to describe it, and then B, you're going to provide a situation where negligence could occur in a healthcare setting. So you'll go all the way through those 4 under negligence. On part 2, you'll do autonomy. Harm can be caused by violating a person's right to autonomy. You'll do the same thing. You're going to provide autonomy, quality of life, substituted judgment, and reasonable person decision, and you're going to put an A and a B for each one. An A would be fully describe the term, and B would be provide a situation to apply your understanding of each concept associated with autonomy. But we want to do that in a healthcare setting. So how could somebody violate autonomy by violating quality of life or not doing the substituted judgment correctly? So how could that lead to harm? So this assignment's going to be due on Sunday, February 23rd. So that's the last assignment. Make sure you knock out all of these things, quite a bit of things, but we have Hybrid Thursday off. Take extra care to pay attention to your research topic feedback, to be working on a research question for your correct topic, and then look at your research topic question feedback. If I get to that on Friday or Saturday, and then bring any questions in on Tuesday when we meet in class. All right, have a nice day.